The Linda Mama program is a program that arose due to the rising maternal mortality rates, the number of women who are dying in the process of delivery. And because of that situation, in 2013, His Excellency the President instructed that we should provide a free maternity. In 2016, the program was rebranded into Linda Mama, and the money was shifted to National Health Insurance Fund, and the aim now was to ensure that the women that did not have insurance cover were now being able to access the maternal care in the facilities, and the money is being reimbursed to the facilities where they attended for the services.
Over the years, we have seen increased numbers of patients. In the year 2017, we treated under this program about 4,500. In the year 2019, we treated about 5,500. And the year 2019, we treated close to 7,000 patients.
In 2013, we just had about 300,000 women going to the hospitals, actually 314,000 women. But as of last year, 2019, 1.3 million women have actually delivered in hospitals. And so you can see that since Linda Mama started, which is a free maternity initiative, the number of women giving birth in hospitals has gone up 3 times.
We have a few challenges as far as this program is concerned. Because of the increased numbers of patients, we have a bit of a shortage of staff, supplies, commodities, non-pharmaceuticals, and sometimes some drugs.
The challenges of limitations of equipment, of health workers is a problem that is prevalent across the health sector. And this is why His Excellency the President has earmarked universal health coverage as one of his big 4 agendas. The national government will also support the counties to increase the number of the amount of commodities that are available in the facilities. So there will be more medicines, there will be more non-pharmaceutical items that are required.
We also have available ambulances. Mothers that who develop complications can be rushed to this facility at any time of the day. And we have doctors, gynecologists, medical officers who are in the hospital on a 24-hour basis, and they are ready to provide their services, especially to those mothers who require emergency cesarean sections, the ones also who are undergoing delivery. The Beyond Zero mobile clinic on a day-to-day basis, it goes especially to those remote areas of our county where the mothers sometimes may not be able to come to the antenatal or prenatal clinics regularly.
We also must recognize the efforts of the Beyond Zero program under Her Excellency the First Lady. Some of these successes we see are also out of the complementary role that Beyond Zero has played in assuring better maternal care.
On first visit to the hospital, they are registered in the antenatal clinic. But let us say there is a mother who has never received any information about Linda Mama and has just come. That mother is also registered in maternity. And when Linda Mama started, we started experiencing a number more than 100 clients per day. So at the same time, Linda Mama being incorporated with NHIF, we have seen that now that this mother who is coming for ANC happens to be paid by the NHIF, the first visit 1,000 shillings. That one means a plus to the facility according to the finance.
Since Linda Mama began, the government has provided up to 14 billion shillings in total cumulatively since the 2013 to date. And every year there is an average allocation of about 4.2 billion.
Mtoto wangu wa kwanza nilipata 29 na ilikuwa operation. Ilikuja sikuwa nadhani kama nitafanyia operation. Nikaambiwa mtu yeyote alienda dieta anatoa 5k za dieta. Sikuwa na pesa. Nilikaa hospitali for 4 months. Mbele yangu ilikuja 20,940. Linda mama imenisaidia yenye nilikuja kliniki siku ya kwanza. Niliambiwa ni apply, nika-apply. Nikaenda kwa vipimo, nikaambiwa imenilipia vipimo zote. Na nikikuja kliniki kila siku nisiwe naacha ID na hiyo kandi ya Linda mama. Ile siku nilienda kliniki kwa miezi 5. Hakuna kitu nililipa.
Tunaona Linda mama inatufanya vizuri kwa sababu wakati huo mwingine mbeleni tulikuwa tunajilipia si mwenyewe. Na hizo pesa tulikuwa tunalipa zilikuwa mingi sana. Si ati kidogo. Na sasa tunaona tukienda kliniki ni bure. Tukikuja huku maternity ni bure. Sasa wakina mama wanafurahi sana kwa sababu ya hiyo nini ya kulipiwa na Linda mama. Kwa sababu hiyo ni fishi ya kulipia watoto shule. Na sasa nimesaa. Si unaona hiyo fishi naenda kupeleka shule. Mtoto hatabunguzwa ama nikule si nitakuwa vizuri. Ama ninunulie watoto nguo na utakuwa mzuri.
2013 ilikuwa ile wakati our president alitangaza akasema ni free maternity, ndio nilikuwa najifungua. So nilisaidiwa na free maternity. Tunafurahishwa na Linda mama. Mara yangu ya kwanza kusikia mama Linda mama, nilienda clinic Kimbembe Hospital, wakani introduce about Linda mama. Wakaniambia ni register na itaweza kunisaidia kwa kujifungua kwangu na kwa kliniki zangu zote. Ni ukweli imenisaidia kwa kliniki zangu zote na hadi hapa saa hii najua nasimamiwa na Linda mama. Itanisaidia kuangalia mtoto wangu na pia mimi mwenyewe.
Nimekuwa nikitumia Linda mama wakati wote wa clinic. Nikajifungua mtoto wangu wa kwanza October 27. Bili yote ikaketa. Kwa hivyo mimi kwa upande wangu naweza sema Linda mama imekuwa na manufaa mingi sana kwa wamama na watoto wao, wamama wajawazito na watoto wao, kwa sababu mtoto pia akiwa mgonjwa inaketa for the bill yote, mtu halipi chochote. Nilikuwa nimekuja kwa sababu ya mtoto wangu apate sindano ya wiki 10 na tumeweza kusaidika pia.
The other key indicators that have improved for us is the issue of vaccination of children. When more women go and deliver in hospitals, you're almost assured that the child is immediately able to access the initial vaccinations that they require. So that has had a very positive impact in ensuring that the child health is improved, reducing the number of stunted growth in children because of that postnatal care that is immediately offered to the children when they are born.
We have noticed an influx of mothers since the introduction of the free maternity Linda mama, and our patients have been taken care of well after that, and they're actually coming, they deliver and they're paying nothing. We are having more mothers delivering in a hospital unlike before, so this has led to an improvement in terms of survival for the babies who are getting born because they're getting the right care. The mothers are also attending antenatal clinics up to 4 times without paying. So that has also encouraged them to come to hospital more frequently than before. And actually the outcomes have improved.
The numbers of patients we are seeing has increased. We used to get only 42% of mothers delivering in a health facility. And that has increased to 50%, the current number. It's still not good enough, but at least we've seen some big improvement since Linda Mama program was introduced.
In our county, we have a program where we usually pick mothers from home and from the nearest health facility. So we usually have ambulances on standby that usually pick the mothers from home. most people have the number for the hospital. So they can either call from home or they go to the nearest health facility, and the facility in charge will be able to call us for an ambulance. We have had mothers dying because they could not manage to come to hospital. They come from hard-to-reach areas. So this program was started to make sure that no mother dies or every mother has access to delivery services and also healthcare.
Well, the county has put a lot of investment in terms of human resource. Last financial year, we employed 643 healthcare workers. We've also been improving the infrastructure. Currently, we're opening a theatre at a place called Saikuru, which is in the far north of the county. This is a very vast area which didn't have a theatre where the mothers who probably had complication would have to go there. The mothers used to travel 200 kilometers to get to Mwingi, which is the nearest hospital with a theatre.
We have concurrence and agreements with the counties that the national government will support in increasing the number of health workers in the health facilities. And this will be through internship programs which will be supported by the national government, and will be able to avail interns of up to 4,000 across the country. And these are health workers to be deployed in the various facilities and fill the existing gaps. They will also be supported to actually recruit now the qualified health workers, again, to fill the existing gaps in the hospitals.
At least every day we see more than 50 number of antenatal women coming. So basically they receive the mother booklet, and then we register them in our antenatal booklet, in our antenatal register. From there they are registered for the leader mama, where they are assured that this leader mama will take care of them throughout the antenatal visit. We are able to detect if there are any problems during pregnancy. If there are any complications, we deal with them quite early. Definitely leader mama, it has done a great work towards the visitation to the women.
Those ones who have been done cesarean section, it caters for 5,000, as well as those ones who have delivered, they also cater for 5,000. As well postnatally. Once a mother delivers, she can be done checkup 4 times. One checkup, we do it after 10 minutes, then 48 hours, then we continue it until 6 weeks in the postnatal clinic.
Linda mama imenisaidia sana. Nilikuja huku General Clinic nikaambiwa nichukue linda mama juu itanisaidia wakati nitakuwa najifungua, sitalipa chochote, na ukweli nimeona imenisaidia sana juu nilikuja huku date 15 ndo nilijifungua na operation yangu ikakuwa na shida up to now, lakini jana nilifanywa nilishona kidonda yenye nilikuwa nayo mpaka saizi niko sawa.
Nilichukua linda mama kadi mwaka jana tarehe 3 mwezi Oktoba, na kutoka hiyo siku hiyo linda mama kadi imenisaidia sana kwa kulipia matibabu yangu, sababu nimekuwa na shida za mwili, kulipia matibabu kama za pressure. Nilikuwa na wakati wa Desemba nilikuwa na homa na malaria mingi, na nilikuwa hata wakati mwingine natuma kufanywa picha ya ultrasound, na hivyo vipimo vyote kama ningekuwa natumia pesa yangu ingekuwa juu kwa upande wangu. Kwa hivyo linda mama imenisaidia kugharamia hayo yote, na kufikia hata saa hii nimejifungua bado ndio naendelea na kutumia
kadi ya linda mama. Imenisaidia kama mimi mama mjamzito. Kitu ya kwanza imenisaidia kupitia kwa chanjo zenye tunazotumia wakati tunapotembelea katika kliniki zetu, atulipi. Kitu ya pili inasimamia vipimo vyenye tunapimwa wakati tunapotembelea kliniki zetu kama wamama wajawazito, atulipi. Kitu ya tatu inatusimamia matibabu. Tunatibiwa na atulipi.
Once the mother deliver, we talk of the hygiene of the side of delivery, as well as the nutrition part of it. The mother is supposed to eat well to quicken healing. We also advise them on family planning, whereby in maternity we give it as a package and we give it here and it's free of charge.
The focus will be to strengthen the capabilities at the level 2 and the level 3 health facilities where the citizens, have the first point of contact to healthcare. So they will be supported to have more equipment at the hospital. And here, one of the strategic ones in the context of maternal care is ensuring that we have got maternal equipment related to maternal and child care.
The patients, in terms of numbers of admissions, have increased. We've received more mothers who are coming here because of the free service, also because of the enhanced care delivery services in terms of ambulance services. The ambulance services have increased. We have received more ambulances. We have around now 6 ambulances that cover the vast areas. There is somebody coordinating the response in terms of coordination of the ambulances and reaching of mothers from wherever they are.
For the preterms, the mother are not discharged and they stay here until the baby gain weight. For you to have a preterm labor, so many things has to come about. You can be sick, you can spontaneously have a preterm labor. Yeah, and even right now they've improved going to the clinic. And sometimes we don't, whenever they come early, when they are having the labor, they are being tocalized and we can keep them for sometimes before the labor comes about. So sometimes we even prevent those preterm labors by medications that we're giving.
We had an average deliveries of 198 per month in 2018. So that one is a good step. Around 38% of increase for our deliveries. So it has been great, I think, for the mothers of Isiolo County.
It has also really had a very positive impact in terms of reducing the number of infant mortality and neonatal deaths. Because when a mother is delivering at a health facility, should there be a challenge, then of course they're in the hands of skilled people and they're able to have the necessary care and support and ensure their own survival and the survival of the child.
Nilijiandikisha Linda Mama tarehe 1 mwezi wa 7 last year 2019. Nilijua Linda Mama kwa hospitali. Nilienda clinic the first day. Daktari akanieleza kuhusu Linda Mama na akaniambia ni muhimu nikuwe na Linda Mama. After amenipea kadi ya clinic, wakachukua ID, wakaenda kuregister na kadi ya Linda Mama. Nikapewa tu immediately hiyo card. So every visit nikirudi hospitali clinic naenda na hiyo kadi ya Linda Mama. Ama kuna time nilikuwa naenda pia kuna time nilikuwa naenda hospitali kama si clinic, but nikienda tu na Linda Mama sikuwa naitishwa bill. Naenda tu wananiambia kama niko na kadi ya Linda Mama na wananipea medication.
Nilikuja huku nikajifungua. Na wenye nilikuja huku nikaingia Isiolo General Hospital nikajifungua salama. Hakuna chochote nililipishwa. Hakuna chochote niliambiwa. Tuko hapo sasa. Lakini pande sasa mimi nimetoka Isiolo County. Huku chini sasa kuna kwanga na rough road, mara unaambiwa unatoka huko unakuja kujifungua ya General Hospital. Unaweza kuwa na shida yoyote, niwezi fika hapa na hospitali yenye iko karibu, utadaishwa pesa. Na kama kuna Linda Mama unaweza ingia, unaweza peana hiyo card
alafu usaidike.
We had cases of mothers who are staying in the hospital for long because of unable to pay their fees until the free maternity came in, then the Linda Mama. That is the only time now mothers can walk in and walk out free with their children.
I encourage enrollment into the National Hospital Insurance Fund and the Linda Mama program. It is my hope that all Kenyans are protected against financial hardships associated with healthcare.
We also want to urge our mothers to visit the hospitals to deliver at the hospital and to ensure that they go for their ANC clinics, the antenatal care clinics, because we have observed that we are doing very well with the first visit. At least 98 of the women who finally deliver in the health facilities do go for the first ANC, but we are still low on the fourth ANC because we are averaging about 54% of the women. So we would also urge us as Kenyans to also take responsibility of our care and to make sure that we visit the hospital.
Wamama wote, hata kama uko na medical scheme nyingine, kila mama yote pia achukue hili na mama, itatusaidia.
Mama wote naweza kuwaomba tafadhali turegister Linda Mama, sababu Linda Mama inasaidia kwa kila mtu, na mtu yote anaweza kuwa na mtu anaweza kuwa karibu kujifungua mama yoyote. Wacheni tumuadvise about Linda Mama.
Ishara ya uongozi bora, mama wote wanafaidika. Ishara ya uongozi bora, vijana wote wanafaidika. Ishara